And chaos continues for people across Indiana who cannot get to critical medical appointments. We're taking your concerns directly to the head of the agency in charge of the program that's leaving patients stranded.
The complaints of dozens of families are not going unheard. It's a story our Call 6 Investigates team has been tracking for nearly a week.
So new at 11 and only on RTV6. Chief Investigator Rafael Sanchez reports changes are now being made to fix a program that's meant to help people, not hurt them.
Kenya Jamila had a tough time on Tuesday on the phone. She was trying to confirm that her son Tariq, who is autistic, would get a ride to his appointment.
I haven't received a call back, and that's what I'm just calling to follow up on.
3 previous attempts were no-shows, and asking to talk to a supervisor.
But every time I call, it's like, you all don't really know anything, and I was wondering if I could speak with the supervisor.
Got this response at 5 o'clock. Quote, "At this moment, I don't have a supervisor available. She's gone home for the day. It's time to go home." End quote.
I'm angry, frustrated and angry.
It's been a chaotic 13 days since the state's new transportation management system, Southeast Trans, took over on June the 1st. Their job to coordinate the rides for thousands of Medicaid patients did not go well in the first 2 weeks. Statewide, people found themselves stuck at home, unable to get to critical medical services, from surgeries to dialysis.
This is disaster. This is what I would say. This is a disaster.
Addressing the problems are top of mind at the Indiana Family and Social Services Administration. Dr. Jennifer Walthall oversees the agency and the multi-million-dollar contract with Southeast Trans.
Every day you folks come in to do the best you can with what you're given. On this issue of Southeast Trans, though, it seems that the rollout was chaotic. It was not really put forth in a way that represent the best of what you value every day. What happened? Because people were let down.
Absolutely, I agree with that. This rollout has been disappointing across the board. That being said, we have been and are continuing to have this as our agency's top priority to remedy. So our sincere apologies for the members that we have harmed in that transition.
The secretary says changes have been made to improve the system, from adding staff to the call center to adding separate phone lines for medical facilities and EMS to request patient pickups. To our meeting, we brought videotaped questions to the secretary from families that for the first time in years were forced to face a health risk because their ride was a no-show, including Tariq's mom.
It is my sincerest apology that you had an interruption of service for your child, and we are committed to making sure that that never happens again. The reason that we chose to make this change is so that the individuals that were getting the kinds of services that you get, it sounds like you get, that everyone could get. And again, my sincere apology that that has had an interruption for you, and we will absolutely make it right.
It's what people like William in Indianapolis, Greg in Anderson, Terry in Muncie, and Jennifer in Marion are counting on. They hope the last few days will be a thing of the past because their lives depend on it. The good news, Tariq did get a ride today to his appointment. The state says that it plans to have Southeast Trans reimburse people who pay out of pocket to make it to their doctor's appointment, like Tariq's mom, who paid $16 on Lyft to get to his appointment, and the Jones family that paid $80 on Uber to get to dialysis. Once FSSA has that plan in place and that process, I'll pass it on to you. Rafael Sanchez, RTV6.
The state's transportation system handles about 200,000 non-emergency Medicaid recipients. To make an appointment, call 1-855-325-7586. To check on your ride, press 2. And there are some improvements to the call center. Wait times have been hugely slashed from June 4th, when it took on average more than 9 minutes to answer a call. As of this afternoon, the average was about 90 seconds.